Hi, everyone. I'm with Christal Parker with Savvy Beauty and Wellness, and she has given her time to chat with me today about all things hormones because hormones play an important role in our lives, which you're going to learn from Christal. So,
Yes.
Christal, thank you for chatting with me today.
Yes, you're very welcome. Pleasure to be here.
Can you tell us a little bit more of what you do?
Yes, so I am a certified nurse practitioner, family nurse practitioner, and I specialize in hormone therapy and weight loss primarily here. I do some IV hydration, but my love is all things hormones.
Awesome. And I know with my clients, like a lot of the conversations that we have, because a lot of my clients are older, and they see things like dip in energy and how
Hmm.
they feel, their
Hmm.
mood, maybe their strength.
Yeah,
So I'm excited to talk about how hormones play a role in that and how
yeah.
you can help people who experience that. But I'd like to know what got you into this field.
Yes, so like many of your clients, suffering from fatigue myself, and that's usually what brings clients in. But I had two babies back to back, and my hormones were all over the place. I didn't know what was wrong with me. Now I know that my body was experiencing something like perimenopause, just when your hormones are fluctuating.
Mm.
So low energy, low motivation. Just brain fog. I remember, seeing videos of myself and I'm like, what is that word? What is that word? Couldn't think of it. A lot of brain fog, things like that. So, I just happened to be at a conference and the doctor was talking about hormones and I thought, oh, I'm too young for that stuff. But when she listed off the list of signs and symptoms, which are over 30, I realized I had a lot of those. So I started just researching it more for my clients, and then in learning it, they want you to get your hormones replaced so you can see what it feels like. And wow, it's like, as many of my clients say as well, it's like the light bulb switched on. And I found myself energetic again, motivated, wanting to go to the gym, wanting to work even harder in the gym. And I said, wow, if this works for me, I wonder what it can do for my clients. So I slowly started talking to my clients about it, and they started doing hormone therapy, and just seeing the transformation in everyone made me totally change my whole practice from doing aesthetics, Botox, and fillers to focusing mostly on hormones and weight loss.
Wow, that sounds like
Yeah.
you had a huge, powerful experience
Yes, very powerful.
with that. And how now, how do you help your clients in terms of navigate when they start to feel this way? Like, what does that look like when they come to see you?
Sure. So again, most of them come because they're fatigued. They don't know what's wrong with them. A lot go to their doctors and try to, see what's going on. And they tell them, I've heard all the gamut of excuses from
Yeah.
doctors, from, you're too young to be going through that, to, menopause is just a phase that you're going to pass through. So they usually come to me, seeking help, because a lot of my advertisement is telling them that, if you feel something is wrong with you, then something most likely is. If you see the back of my shirt, it says, it's not you, it's your hormones, because that's essentially what it is. So a lot of my, marketing is that, speaking to my clients, I know exactly what they're feeling. So they usually are like, maybe this can work for me. And it all starts with the blood tests. I check, patient's blood, client's blood, see where your levels are. I always say that the blood work is really a starting point so we can see, but it's really based off your symptoms. If you are, even at the top range, but you're telling me you're still having some hot flashes, I'm going to give you a little bit more hormones until we can, get you in a place where you're feeling at least 75 to 80% better. But I would
Mm.
say most of my clients come because of that reason, and then, check the blood work. They're usually amazed to see what it shows as far as their levels being low, and then we get started with different types of hormone replacements based on their lifestyle, budget, and what they're feeling.
I love the individualized approach that you
Yes.
take. It's not. It doesn't seem like it's come on in and we'll give you the same plan as everyone else. It's
No,
what are
absolutely
you
not.
experiencing, and
Yeah.
so I think that's great. Let's talk about, because I know, like, for a lot of my clients, when they hear hormones, we understand there's different hormones at
Hmm.
play. Do you
Yes.
mind kind of expanding on like which hormones are we looking at and
Hmm.
how they kind of affect the human body?
Yes, so for men, we are most likely replacing testosterone. Uh, that is the main sex hormone of the man is testosterone. Also, I work with thyroid, so we'll check the thyroid as well for both men and women. With women, we are replacing, depending again on where they are, where their cycle is, if they're having a cycle, if the cycle's skipping, we will normally replace either estrogen or testosterone, or both. Also, progesterone is another hormone that is all given through pill form, that helps you sleep. If you're having the mood irritation, just feeling very anxious at night, can't sleep at night, I always say anxious racing thoughts thinking about what you have to do the next day. You can't fall asleep, or you fall asleep and then you wake up. Why? Because of a hot flash or because you have to go to the restroom a lot of times during the night. Also another hormonal issue. And then you cannot go back to sleep because your mind is then racing. We will help you out with some progesterone that helps that. So those are the main ones. Estrogen, I always say estrogen, think of it as your lubricator. So if you have, joint pain, if you have vaginal dryness, dry eyes, dry hair, dry skin, that's usually an estrogen problem. Estrogen also has to do with mood, or it helps to calm the mood as well. And then your testosterone is what we call your GSD, or your get stuff done hormone. So that's the energy, the it helps you to hold on to muscle and lose fat and keep your muscle, because muscle strength is very important as we get older. Before being younger, you do a lot of cardio and those things, but when you get older, you really want to focus on maintaining your muscle. So hormone therapy, I also want to say, is not just for symptom relief. So most of my clients come to me because, of course, they're having these horrible symptoms that they want relieved, but estrogen helps with brain health, heart health. It's an anti-inflammatory agent. It helps the brain, so it can decrease the chances of people getting Alzheimer's and dementia. And it also protects the heart, and it protects the bones. So if you're older and you break a bone, the fatality risk after that, or the instance of people dying after a fracture, is very high if you're older. So it helps to maintain that bone strength. And then also the thyroid, of course, that controls a lot of the metabolism. It controls if you're cold all the time. It's usually a thyroid problem. So these hormones are not just for symptom relief, but it actually helps with longevity. It keeps you alive longer with these hormones. So that's why I love hormone therapy as well. Everyone's looking about how to stay young and feel young, of course, not necessarily having to look young, but at least feeling young in your body, and having your body feel the same way that your brain does. Because we feel young, but our body's not always working the same way.
There's a little bit of
disconnect.
Yes, absolutely. And I love that you how you labeled each hormone. It makes it a little bit easier how to categorize them.
I can talk to someone and say, that's this problem. Some of them overlap for sure, but you kind of have your main, if it's mood, some energy, but your biggest thing is your hot flashes, and I'm like, okay, that's the estrogen problem.
Sure.
If it's strictly like mood, motivation, or if it's more so like motivation, the brain fog and energy, you're just always tired, then that's more, I think, of leaning towards testosterone. But again, we check all of them, and then based on how you're feeling, how your cycle is for a woman, we will we'll both together decide on what we're going to replace. But for men, it's mainly men come in because of low libido, low sex drive. That is in both men and women. Testosterone helps that. So, a lot of women think like, oh, I'm just tired of getting older. Like, no, it's your hormones that are at play there.
Out of curiosity, do you find that women are surprised that like testosterone comes to play with them? Because normally you think that as a male hormone.
Yes, and men have estrogen as well, and women have testosterone. So we just have a way less amount of it. With men in looking to replace their hormone, I'm looking for men to be in the range of 950 to 1100 on their testosterone. With women, I'm looking for them to be about 200 or less. So that's the difference, but we both need each hormone.
Awesome. Thank you for sharing that.
Sure.
So what I'm more interested in now is, okay, so you have somebody whose hormones are not in balance, they're not feeling their best, they know they can feel a lot better. What are the treatment options, or how do you navigate that?
Yes, so there's a couple of different treatment options. For testosterone, there is injections, there's creams, and then there's pellets. So I bought some pellets here, and I think Ray's going to show a video, but they're very tiny. You'll see little pellets that I do a procedure here in office where we numb you up, so you're completely numb. All you feel is the initial little pinch and little sting, and then after that, I make kind of like a little tunnel in the back flank area, and we make a little tunnel, pop the little pellets in, close it up with just some steri strips or like tape, essentially, and then keep it covered, no soaking in jacuzzis or hot tubs for about 3 days.
Darn.
And then you have a I know,
Mhm.
then you have a consistent flow of the hormone. We can put estrogen in there as well. So you have a consistent flow of the hormones for about 3 to 4 months. Those who work out a lot, they're going to run through them quicker because it's based on your circulation of your blood. And those who don't work out as much, you can probably get away with it for 4 to 5 months or so. And then so that's testosterone and estrogen. We can do pellets, testosterone again, also creams and injections. With the estrogen, we can replace that also by creams, pill form of estrogen, and also pills, creams, and patches. So you can have an estrogen patch that you leave on for about a week, or some people will change their patch every 3 to 4 days or so. And then with the progesterone, again, that one is a pill that you take at night. And then with the thyroid, if you need to adjust your thyroid medicine, then that's a small tiny pill that you take during the day.
Okay. I'm wondering, do you find that you prefer someone does one method over the other, or does it just come down to what the person's more comfortable doing?
Yep, it's really what the person is more comfortable doing. Everyone, they love the idea of the pellet. So a lot of people will come to me for that because again, you don't have to worry about putting a cream on daily. With the creams and the oral, you have to take it daily. With the patches, again, that's like a week or every 3 days or so. But it's lifestyle. If someone loves to swim or loves to work out, the patch may be too sweaty or get wet, so they may choose pill form. Some people don't like taking pills or can't remember it, so then we'll maybe use patch or the pellet form. So it really is individualized based on the client's lifestyle. And then also, there are some, if you have history of blood clots, we try to stay away from the pill form because it has to pass through the liver. And if you think of, a lot of people are scared of hormone therapy, but birth control is the same. It's hormones that you're giving through a pill. So there are people who can get blood clots from taking birth control pills, and that's because it has to pass through the liver. So if you are someone who's had a blood clot in the past, then we probably wouldn't do the pill form. We would choose another modality. But other than that, it's really just based on someone's choice. And then the other is, if someone has had breast cancer, actively having breast cancer, or some people who don't want to take hormones, but they're having these hot flashes, there are also non-hormonal treatments for hot flashes as well. So I just want to let
No, that's good to know, and I'm sure that's covered a lot too during the first meeting with you and the consultation.
Yes, absolutely.
Awesome,
Yes.
great. No, that is all great information. I'm wondering, so what would you recommend in addition to, let's say, hormone therapy? What are some lifestyle things that people can work on that would really make that a game changer for them?
Yes, great question. So taking supplements as well. Vitamin D is usually low on most people. Calcium. So taking those different supplements that can also, help. Other lifestyle changes, definitely sleep. We have to get our sleep in. We have to make a sleep routine and make it a point to get our sleep in. There's no way around it. We have to turn off the phone, turn off the TV, and get the sleep in because, much with weight loss as well, if you aren't sleeping, you're not going to see a pound go away. So sleep is definitely one of the most important ones. The other one is stress relief I talk about. So really trying to de-stressify, if that's a word, de-stressify your life.
Now it is.
Okay, right. De-stress your life. So if you're just constantly stressed out and taking other people's problems on, no matter what hormone I give you, you're still probably going to feel like nothing is working. So working on the stress in your life, and then also eating right, getting vegetables in, decreasing carbs and sugar as much as possible. So nutrition is very important. So I would say nutrition, sleep. I also talk about, therapy. Therapy is very important, especially if you feel that you can benefit from it. All those things are important to make your whole life, or holistically make you a better person. So I think it's very important to make those things a priority in your life so that you can, just feel your best all around. And also exercising, we can't forget that. Making exercise a part of your day. Strength training, like I said, is going to keep those muscles strong and also help with, keeping your bones together. So, exercise is very, very important. So I would say those definite lifestyle changes are a huge part of just getting your hormones in your body in order altogether.
I'm on board with that.
Yeah.
That's amazing. I have one more question for you,
Yes.
Christal. Do you have, I know you shared your experience and how much, hormones have changed your life. Do you have an inspiring story or a story that you like from maybe a client who's gone through this?
Yes. Yes, I actually talk about her all the time. Her name is Joni, and Joni is a judge right here across the street. And she came to me first getting Botox, and she, I started talking to her about this hormone thing. And Joni was, I think, 62 at the time. And she was just telling me, I'm good being in the house. I don't really have energy to do much. And I remember when I started her on hormone therapy, I said, okay, you might notice that you're going to have a boyfriend she's like, oh, no, 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 no. I'm good on men. I just want to stay in my house. And, if this gives me a little bit of energy, I'll be okay with that. So fast forward to a year later, Joni has had her hormones replaced. She's traveling all the time, back and forth to New York, all kinds of trips with her friends. She now has a boyfriend who cooks for her all the time. She's working out. She's lost about 30 pounds. So that story is very inspiring to me because a lot of times when people get older, they just think that, well, this is it. At 60 years old, can you imagine, like, this is it? I'm just going to sit in my house and just wither away, and that's no way to live. So Joni's story is very inspiring to me. I talk about her all the time. There's another testimonial on my page from another client, Myra, and saying went to her doctors, tried to get help. They kept telling her, well, stop eating, don't eat McDonald's. She's like, I never ate McDonald's. I don't eat McDonald's. But she was the biggest in her life as far as weight wise, and we replaced those hormones, and on the testimonial she says that I saved her life, and that's because she finally feels better. She thought she was crazy, she didn't know what was wrong with her, but now she knows that it was her hormones. She has since dropped about 40-50 pounds, and even when she first came in, I'm like, are you losing weight? She came to see me about 3 months later. She said, no, I'm sleeping. She could have cried. She's like, I'm sleeping. So I think the sleep is very important, and sometimes, and I could say make a sleep routine all we want, but if you're not able to shut your brain off, how are you going to do that? So, those are probably two of my most inspiring stories.
That is amazing. That is such a big win for them. And for not being able to sleep, doesn't sound like a big deal, but for her, that was life changing for her.
Absolutely.
So that's incredible. All great information today, Christal. Thank you so much for your time and sharing all this information. I can't wait to share that with all the people that I know. Yeah, we absolutely did. Thank you so much. And thank you guys so much for watching.
Hope to see you soon.